Hello, I'm Eric Haneker. I'm the CEO and co-founder of Diabeloop. Diabeloop was founded in 2015 with the purpose of bringing insulin automation and a better, more carefree life to everyone living with diabetes that requires insulin. Our main product is DBLG-ONE. DBLG-ONE is a handset that is going to be connected with a CGM on one hand and an insulin pump on the other. The CGM and the insulin pump are elements that are already on the market. What we bring and what we develop is the handset. The handset connects to the CGM and to the insulin pump wirelessly through BLE. It also sends the data in a cyber-secure fashion to a web platform where the patient can choose to share his or her data with whomever he or she wants, caregiver, doctor, relative, and then the patient really has control over the data. DBLG-ONE is designed to be simple. It only requires weight, total daily dose of insulin. What are your typical meals? It's personalized, meaning that every person living with diabetes is different. You can set your target, you can set the aggressiveness of the algorithm. It's also interoperable because people have access to different pieces of hardware depending on where they live and what they're looking for. In order to be simple and personalized, the algorithms behind DBLG-ONE that will automate insulin delivery every 5 minutes need to be complicated. So the first layer in our algorithm is a safety layer. That's going to be looking at a risk of hypoglycemia. If it happens, it can cut the insulin, of course, can also recommend a rescue carb. If there's no risk of hypoglycemia, then we have an advanced algorithm called a physiological framework that is going to be using millions of differential equations every day for each patient in order to learn from the history and predict where the glucose is going to be and then adjust the insulin accordingly. However, such predictions from the past aren't always perfect, and so we have a supervisor that is going to be determining whether that advanced algorithm really understands well what's happening, because machine learning is not perfect. And then we have an expert system. That's going to be what a doctor or an expert patient would do in a given situation. Those two run every 5 minutes. Then, a few times per day, we have the auto-learning. That's going to be looking at weeks worth of data and look at patterns. Is this person more or less sensitive to insulin at night, during the day? How does he or she react at specific meals? Since 2015, we've had dozens of clinical trials, hundreds of patients using the system. In 2018, published results showed an improvement of 12 points in time in range. Real-life results of our pre-launch 2019 and 20 showed an improvement of close to 17 points. Now, since our launch in April, we've had independent real-life data of hundreds of patients that showed an improvement on average of around 17 points. Now, it doesn't stop there. We have improved algorithms that have already been tested in our validated simulators that will improve time in range a further 4 to 5 points next year. Then after that, with the introduction of neural networks, even further. Interoperability, again, we have worked with Accu-Chek Insight from Roche, the Kaleido pump from Vicenta, the Dana-IR from Suil, and the Cellnovo pump. We've worked with different versions of the Dexcom sensor as well because we want to be interoperable and the system to be available to as many people as possible. Where are we going from here? So 3 things. 1, extended indication for children, for teens. We already have clinical trials that with some published results, excellent feedback on that. Underserved populations, people specifically with highly unstable diabetes, could have dialysis, severe gastroparesis, etc., etc. And also extended to more insulin types. Second point is further improve the personalization. Allow the patient to no longer declare meals if he or she doesn't want to, and have the system manage automatically. Same for physical activity. Second point is hormonal effect. We've already done some small published data that shows the effect of the menstrual cycle for certain women, not all, but many. And lastly, further improve our automatic evaluation of the short-term insulin sensitivity for the past few hours. And then the last point, we want to expand the algorithm capability and the automation to all the other people that use insulin. People that have type 2 diabetes and have pumps, but also, more importantly, people that use pens, so multiple daily injections, both for type 1 and type 2 diabetes. For multiple daily injections, so DBL for pen, it's going to be kind of the same than DBLG1, except it's going to be connected to a connected device or a connected pen. So either a device that goes on a pen, a cap, or a pen itself. Of course, it's not going to be able to adjust insulin delivery every 5 minutes, but it's also much cheaper, so the access will be much wider to many more people. And also some people don't want to wear a pump. And so it's kind of 80% of the results from a glucose control standpoint for 30% of the costs. Everything else will be very similar, except it's going to be an app on a smartphone, on the user's smartphone, and no longer needed a dedicated handset. This will allow us to bring the capabilities of Diabeloop to not just a small subset of people with type 1 and pumps, but to pretty much everyone that has to live with insulin because of his or her diabetes. Thank you very much.